Hey everyone, how is your NCLEX review going? Today we're going to be talking about endocarditis. Again, I do want to apologize if you do hear my infant daughter playing in the background. Um, so today we're just going to go straight to the point with endocarditis, right? What's endocarditis? It's basically an infection of the endocardium, which, as we all know, is the inner lining of your heart chambers, right, and the heart valves. Okay, now endocarditis can actually be bacterial or fungal infection. Okay, and usually it can be fatal if left untreated, but with proper treatment most of our clients will recover. Okay, the problem with I'm sorry guys, the problem with endocarditis is that it can infective endocarditis can cause severe valvular damage, which can eventually lead to insufficiency and heart failure, which is really bad, so we don't want that. Okay, now what are the possible causes? Now, the main possible causes are staphylococci, which is Staphylococcus aureus, and also streptococci, which is Streptococcus viridian. Okay. Now, looking at the assessment, how do we assess our patients? Aside from the usual fever, chills, and fatigue, the patient can also have uncommon um, symptoms, right? Uncommon in other diseases such as rot spots, right? And rot spots is basically when you see white centers on the retina of our patient, and those white centers are actually hemorrhagic areas. Okay. Another one is osternodes, which is basically just tender raised lesions that can be found in the finger or in the toes. Okay. And lastly is valvular insufficiency with our patient's heart valves. Okay. Now, diagnostics. How do we evaluate the diagnosis for the patient? Usually, echocardiography can reveal a valvular damage, and usually the EKG can also show some arrhythmias, right? But the main diagnostic would be blood cultures. Now, there's actually three blood cultures taken at 1 hour intervals that is done in order to enable us to identify the actual causative organism that is causing the patient's endocarditis. Okay. Now, in regards to treatment, bed rest is important. Also, sufficient fluid intake, and also in severe cases of valvular damage, we do need surgery in order to replace the defective valve. Okay. Now, with drug therapy, we can give our patient antibiotics, which obviously would depend on the infective organism, right? We can also give antipyretic, such as aspirin, and anticoagulant. And usually, with a patient with endocarditis, the main anticoagulant that is used is heparin. Okay. Now, what I want you guys to really take note is that you need to watch for signs and symptoms of embolization. Now, embolization, as we all know, is just formation of embolus that might lodge into the bloodstream of the patient, right? So we need to watch signs and symptoms of embolization, such as hematuria, pleuritic chest pain, left and upper quadrant pain, right? Because embolization can actually be a common occurrence during the first 3 months of the treatment, okay? And these signs and symptoms can indicate an impending peripheral vascular occlusion or a pulmonary infarction, which can be bad for a patient. Okay. So again, this is it for now, guys. I just want to keep it short, sweet, and straight to the point. I hope you guys are doing great on your review. I wish you guys the best. Thank you so much for your time. I really do appreciate it. Thank you so much, guys. God bless. Thank you. Bye bye. I just want to make these reviews short and sweet and straight to the point so that, you can really take in the main points and really focus on what is important. So today we'll be talking about synthroid or synthetic levothyroxine, which is basically a thyroid hormone therapy, right, that we give to patients with hypothyroidism, right? And as we all know, hypothyroidism is a condition in which there's an inadequate amount of circulating thyroid hormones, specifically the T3 and T4, right? T3 being tridothyronine and T4 being thyroxine, right? And basically this causes the decrease in the metabolic rate in the body, okay? Now, what we need to take note with Synthroid is that we do have to monitor the patient's cardiac system because there's a significant cardiovascular disease that accompanies with a patient with hypothyroidism, and when we are giving thyroid hormone therapy, there's the client is at risk for cardiac complications if the metabolic rate is increased too quickly, right? Therefore, we do have to monitor the patient's cardiac system for cardiovascular compromise, okay? And we can see these symptoms such as manifesting as palpitations, maybe chest pain, shortness of breath, and obviously tachycardia and a rapid heart rate, okay? Again, I'm sorry, that's my daughter in the background. Also, with this medication, treatment begins slowly, and the dosage is increased every 2 to 3 weeks until obviously the desired response is obtained. And the treatment is also considered a lifelong treatment. Okay, and obviously we're gonna have an ongoing medical assessment of the thyroid function of the body. Now, also, I do want to point out that with clients receiving thyroid replacement therapy, they do need to be monitored for signs and symptoms of hyperthyroidism, right? Which can occur with over medication. Now, these symptoms that I have here is actually symptoms for hypothyroidism, which, as we all know, weakness, fatigue, and weight gain. But like I mentioned before, we do have to monitor the patient for hyperthyroidism once we're giving the thyroid hormone therapy. And the signs and symptoms for hyperthyroidism is irritability, tremors, and tachycardia, and usually palpitations. Okay, so again, guys, this medication is very important in the NCLEX exam. You do have to take note and be aware the important interventions, nursing interventions that we do have to know about for Synthroid. Okay, again, this is it for now, guys. I just want to make it short and sweet and straight to the point. I hope everybody's doing well. I will be making more and more videos from now on. It's just because life has just been very busy lately. Again, thank you so much, guys. I really, really, really do appreciate your time. Thank you so much for everything. God bless. Thank you. Bye bye.